Go ahead and get my yeah. These are so close. It was close today. Good afternoon. Can you hear me? Is this on?
No.
No. All right. Wow, that should be better. There it is. All right. Well, good afternoon, everybody. Welcome to RSVL Rotary Club. If you could silence your cell phones, that would be wonderful. And my name is Jenny Hedall. I think I recognize everybody in the room today and everybody online. All right, so we're going to start out with our flag pledge, and I'll have Al lead us in that.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, and our four-way test of all the things we think, say, or do. First,
Is it true? Is it fair? Will it build goodwill and better friendships? Will it be beneficial for all concerned?
and fifth, will it be fun? All right, you may be seated. And I'm going to ask Lynn to do our invocation, and Lynn has a little bit more enhanced invocation and video for us.
Thank you very much, Jenny. I want to share the celebration of the garden as to where we are at this moment. So I'm going to share that, and then I'll follow that with the invocation. Can you all see this? It's a green screen. Yep. Okay. Thank you. Hold on just a moment.
That was fabulous.
Thank you. Can you see the new
Wonderful.
screen? Can you see the new screen?
No.
No.
You may have to reshare.
How about now?
Yes.
Yep, okay, thank you. Hang on. Well, I'm learning a lot from the Rotary Garden, and this week my invocation is on imagination and curiosity, sort of how to break open the normal ways of seeing life. Last week, I was challenged by our speaker. I was fully in sync with him that these times in which we live are transitional times. This is liminal space. Yet when he talked about the breakdown of relationships, I questioned the language, the wording. Instead of breakdown, what if we were to use a more natural, organic image or symbol or language? What if we were to use the life, death, life cycle that nature continually models for us? In the fall, what is amazing is that what we call dying is really the dropping of seeds into the ground for the abundance to be available next spring. Is nature dying, or is it planting seeds? What if we were to use the language of the feminine principles? Instead of breaking down, we said that this is a time of incubation, a time of gestation. Parents are so aware that when they are pregnant, there is no knowledge of who the child will be, what personality the child will have, whether the child will live until born, whether the child will be healthy. And yet the mother will eat well and sleep well and slow down on stressful living for the sake of what is to come. What if this time of our society and global community is one of gestation, of incubation? We have no idea what it will look like, yet we care about it, figuratively speaking, to eat well and sleep well and more. We want to bring our best selves to it. If we use the natural, organic language, we have to engage imagination and curiosity. So it's just 3 examples from our Rotary Garden. As the YMCA daycare children, the 3 to 5-year-olds, they were quite young, walked around the garden, I pointed out different vegetables and engaged them with, what vegetable do you like to eat? And then invited them to think differently. When we came to the mint, I said, how many of you like mint? No hands went up. No exciting, yes. Not one of them was impressed. They didn't like the smell and really didn't think it was worth their time. I said, have you had mint? No hands went up. No exciting, yes. Then I opened their imagination and invited them to be curious. I asked them, how many of you like mint chocolate chip ice cream? Oh, from non-interest to total excitement. You see, it wasn't the norm of how to use mint. Yet with imagination, it brought a new way of using mint that excited the children. Do you know what these are? When the garden continued to flourish and we had not harvested all the radishes, the tops of the radishes were growing these little pods. I was about to cut them off and compost what isn't the radish. I stopped, looked them up on the internet and found they are called bots. That's B as in boy, bots. They can be used in stir fries. You see, it didn't produce what I thought was the norm. Yet with imagination, it brought something nourishing and life-giving. This is cauliflower. The leaves are huge, yet they grew no heads of cauliflower. We have nothing to harvest as far as heads of cauliflower. And since it wasn't what I was expecting, I was about to pull it up and compost it. Yet again, thanks to the internet, I discovered that cauliflower leaves are very much edible. You see, it didn't produce what I thought was the norm. Yet with imagination, it brought something nourishing and life-giving. The garden is teaching me that what I've known, what I've expected, what I was even looking for is not necessarily what appears and is nourishing. What does that say for our current situation? In this time of gestation, of incubation, of seeding in your business, in your family, in our global community, be curious, be imaginative, and eat cauliflower leaves, bots, and mint chocolate chip ice cream. Thank you.
Thank you, Lynn. It was super fun to see all of the garden's progression from the dirt to the robust leaves and greenery. And yeah, lots of different choices for us. So we have a few announcements for this next week. Tomorrow night, we've got the club picnic at Dale's. So Dale, thank you. Thank you to Dale and his family for hosting us there. Remember, it's bring your own meat, bring your own silverware, and a dish to pass. So love to see everybody out there. And then David would like to also come up and give us an update for every meal.
Well, good afternoon. Being the volunteer chair now, I've been very busy getting some stuff lined up. So again, this year we teamed up with Every Meal, and we're gonna distribute food at Brimhall, and that starts this Friday. So right now I have 10 signed up, and need to have like 3 volunteers from 11 to noon. And we're just trying something new. We're gonna do Sign Up Genius, but if you don't like doing that, there was an email that went out September 14th. From Kathy, but if you would want to just let her know if you want to volunteer, or she's bringing it to all the meetings, and you can handwrite in if you want to volunteer, if you're not comfortable using Sign Up Genius. But that starts this Friday. And then the other thing we got going on is you heard more about is Snelling Avenue cleanup is going to be October 9th. So look for information on that. And then see, Scott's here. We're going to do ringing for the Salvation Army this year. So look for something like that coming up soon. Thanks.
Lots of ways to get involved, which is awesome. Just kind of reflecting on a few of the things I'm noticing here today. I loved the cycle of life, and I think we have some celebrations of life with Don's passing, or the celebration this past weekend. And just want to take a minute for all of us, as today is the one you're passing. So just remember those. But with that, let's do some happy dollars. So my happy dollar is that my aunt snorted all the time and had the funniest jokes. And so I just thinking about it.
I'm gonna put in $20 because I was very happy to be able to attend the celebration for Don Craig had. I picked up Dallas, Alberta, and he and I both went there, and were able to listen to what a great people talking about how much Don had motivated them. And they were handing out his card. Don is the consummate business card man, and he's got another new card, which was just, I think, one of the cutest ideas I've seen in a long time. So it's very wonderful to hear about a lot of the employees and friends, colleagues talk about how much Don had motivated them to do something good in their life and to join Rotary and get involved. So it was a very inspiring conversations that we got to listen to.
Hang on, let's get to the mic so we have lots of areas.
big weekend, as we had a celebration for my mother who was 90 years old. So we had a big birthday party for her, which was very cool.
A couple of dollars, our daughter and son-in-law had enough confidence in grandma and grandpa to leave the two kids with us for 10 days while they're off on a cruise. My daughter, unbeknownst to me, just applied for a job. She, her name's Brianna Cook. She's very good. She still goes by Shelby. But anyway, she's the new social media manager for Rotary International. I have $300 here to put in as myself as well, in memory of Don Craighead, who when he was at our meetings, oftentimes would put $1 in and start doing $10 worth of talking. So we finally got him on the pattern of maybe paying for by the minute rather than just 5 minutes.
All right, anybody online?
Yeah, I've got some happy dollars. I'm just happy I have COVID antibodies now.
I've got a couple of happy dollars here in memory of Don Craighead. I met Don before he became a member of this club, when he was a member of the Lake Early. It was kind of an interesting meeting. I was the coordinator for our youth exchange with Sweden at the time. And he and Sandy were hosting a Swedish exchange student, but through another organization. And they had kind of totally abandoned this young lad. So he had no contact, hardly at all, with his sponsor. So Don called me and asked me if we could take him in. And we took him in, and he was just the most appreciative young lad. And he became a Rotarian eventually, just because of something that's on him. That's what I got.
Great job.
Okay, hello everyone. I have happy dollars also. I want to give happy dollars in honor of Don Craighead, who is and was such an amazing person, a contributor to our club, and just such a great connector. And I just always have appreciated his contributions to us. And it's great to see Sandy here. Hello, Sandy. So just thanks so much for him. And then I want to also give happy dollars in honor of Lynn Scott, who did this amazing video just now for our garden and all the work that she did for our Rotary garden and is doing for that. She has been just amazing at pulling it all together, sending out notices, making sure we're connected. She and Ted and Galen and there's just so many people that have done so much, and David have done so much work on that. But thank you, Lynn, for putting that great video together and for all your work on behalf of the garden. You have just been a star. So thank you.
All right. Well, with that, I'd like to turn it back over to Ed to tell us about your COVID journey.
All right. Thank you. Let me see if I can share my screen here. Okay, do you see that?
Yes.
A few weeks, a few weeks back, I came down with COVID, and certainly I thought this picture kind of represented what that journey looked like. A winding road, and sometimes it seemed like there weren't no answers for what was going on, and the best direction for one to proceed on in terms of returning to health. So a couple of statistics first, just to bring you up to date on what COVID looks like across the country. As of last Friday, there was 41,915,000 cases with 670,000 deaths, which is a survival rate of 98.4%. And in Minnesota, it's about 682,000 cases and about 8,076 deaths, or a survival rate, a little bit better than the national average. The reason, and I think a lot of you have heard of late, most of the new cases are this Delta variant that is going around and seems to be highly, highly contagious. And so here's a trend for the US trend line, and you can kind of see where we were at the end of last year, or I guess beginning of last year, end of the year before, beginning of this year, sorry. And then we got a little better in terms of number of cases and how it was being spread, and then the Delta variant came into play, and you can see where we've kind of hit a new spike in number of new cases. And now this is the Georgia infection trend. And why is the Georgia infection trend important? Well, on August 30th, I traveled to Georgia for a board meeting. The board meeting was about 27 people, and it was held at Sea Island, Georgia. And I don't know if you guys have been to Sea Island or not, but it's an awesome, beautiful spot. And the resort where we were having our board meeting actually hosted the G8 summit a few years back. I'm not exactly sure what year, but we actually, for some of our meetings, got to sit around the table where the G8 folks had conducted their meetings. So it was pretty impressive, and there was a brass nameplate on the back of each chair that told you who sat where during the G8 summit. So you could even identify whose chair you were sitting in, if you will. But as you can see, Georgia is similar to the national trend. This yellow line is the 7-day number of cases, right? And this peak right here, I told you I went there on August 30th. This peak is August 31st. So I was heading into the lion's den and really did not realize, what it looked like in Georgia and how that might impact our meetings. So on September 4th, we had gone through our meetings and we were pretty much wrapping up. And I had gotten up on Sunday, September 4th, and started feeling, kind of headache and maybe fever, but it just wasn't right. But again, I hate to jump to conclusions. Lynn and I were talking a little bit earlier. We're optimists, so I certainly didn't want to assume that there was COVID kinds of things going on. And so if you do a little bit of research from the CDC, the symptoms of COVID-19 certainly are fever and chills. And as the next day or so progressed, I started to have some of that sweating in the morning, freezing in the evening. Didn't develop a cough until later. Shortness of breath wasn't an issue. Fatigue was. I was feeling kind of down. Muscles and body aches, which is interesting because they moved around. It was no reason for certain parts of my body to be aching. Right now, my feet kind of hurt. And again, I've been on my back for a couple of weeks here, there's no reason for my feet to hurt. But headache was a big thing. The first week for sure, well, even into the second week, the headache that just didn't seem to go away, and loss of taste and smell, which is kind of a misnomer, I guess, because what I experienced anyway is not a loss of taste, but everything I ate or drank tasted bad, really bad. Very, very salty, or just kind of a bad taste. Didn't have a sore throat, never did. Never felt congested or runny nose. I'll skip the last couple because some of you might still be eating, but I just wanted to, those were kind of the telltale sign, right, for COVID. They tell you it's the loss of taste or smell, and things just didn't taste good. But I have talked to several people that have literally lost their taste, so anything they ate tasted like nothing, right? Had no taste whatsoever, which might be a better option, as we'll talk a little bit more about my experience. So then, following those days, and I started losing my taste, and it's like, okay, this seems like it's COVID now. And I did my best to continue to work, and I isolated in the lower level of the basement, and kept going through email and doing my normal work. And what I found after a couple of days is it was pretty easy to work early in the morning till late in the night, because I had all this work to do and I didn't have to go anywhere. And so after a couple of days of this, I decided that, you know what, I have to stop. I have to stop everything. So I sent an email to my partners and I said, I have to shut down. You have to do this. You have to do this. I have, kind of gave some assignments of things that I thought were really critical for work to continue. But I had really good support from them in terms of picking up and giving me the opportunity to rest. But what was interesting over that time, the word gets out to my brothers and sisters and to family and friends, and all kinds of advice comes. And we'll talk a little bit more about this, but there's so much information, some of it good, some of it bad, about COVID and the treatments and things like that, it was just amazing. All of the things that people said I should try, right? So I took a picture of all the things that people said I should try. Certainly hydrating with the Gatorade, and that tasted bad. And that's why none of those bottles are empty. I tried 4 different flavors to see if something would help there. But the high potency vitamin C, vitamin D, all these other supplements that people suggested you take, and even the nebulizer, I didn't even know about that as an option. And what's interesting, and we'll talk a little bit more in a couple minutes, is the different take that the healthcare professionals have on some of these things versus what your family and friends hear. So who do you trust, right? Especially when it comes to stuff like that. So I did talk to the doctor, and the doctor, or actually the CDC says too, take medications like acetaminophen and ibuprofen, drink lots of water, and or receive intravenous fluids to stay hydrated. And I don't know how you do that at home, but it says outside the hospital, and get plenty of rest. And getting plenty of rest wasn't an issue because the fatigue was there. I did sleep a lot during my time. So then the Thursday or the Friday of that week, I was telling you that I had worked really long hours for Tuesday, Wednesday, and then Thursday, Friday, I was just out of it. Headache to a point where I couldn't hold my head up and those types of things. So I did call and set up an appointment with the doctor, and what I had thought was an appointment for Tuesday turned out to be, when I got the confirmation, an appointment for Friday, a week away, and which was depressing, of course. So that was a mix-up I had to resolve. And when I called to resolve that, she asked me a lot of questions about how I was feeling. And by Friday, then my chest started to hurt. And then she was concerned that it might be something more than COVID. I, kind of like, well, I don't think it's anything more than COVID. And she said, well, I would say you should go to the emergency room. And that was Monday night. And I decided, I don't need to go to the emergency room. This is just COVID. And then Tuesday morning, early Tuesday morning, my chest really hurt. And so that convinced me to go to the emergency room. Well, the emergency room, of course, they looked me over and decided that it's just COVID. And what's interesting is when I was talking to the doctor at the emergency room, he said, well, since you have a mild case. And I thought, why do you keep calling it mild? It wasn't mild to me, right? But at least I wasn't, I guess, hospitalized, which is, in the more extreme cases where people went. So what also was interesting during this week is the email that we're flying back and forth. There were 27 of us that were at the board meeting, the trustees meeting that I was at in Georgia. And of 27, 8 of them had tested positive throughout the week. So it was I don't know if you'd call that a super spreader, but certainly very contagious in our circles. And I don't know if it was us passing amongst each other or other people that were at the resort. Another interesting statistic here is that it's the non-vaccinated people that are getting COVID, this Delta variant. Well, 7 of the 8 people that tested positive were vaccinated. So it certainly is something that continues to be an issue for us as a country and to those both vaccinated or not, right? The emergency room doctor sent me home and said, you know what, we can't do anything for you. Just go home and take aspirin and hydrate. And I asked him about some of the alternative medications and treatments. And he said, well, I can't help you with that. You're going to have to see your regular doctor. So that was how I felt on Tuesday before I went into the emergency room. And again, maybe these are some odd things to be showing you, but I thought the chest x-ray that they took, they had a portable x-ray machine. I've never seen one of these. I thought that was pretty cool. Where they could wheel it into the room and he wouldn't even have to get close to me. He could take an x-ray of me from across the room. But fortunately for me, my chest was clear and all of the testing they did, blood tests on my heart, it was fine. So again, he said, you have a mild case, go home and take care of it. One of the alternative treatments we talked about with this monoclonal antibody infusion, which that treatment is interesting because it's produced in the laboratory. These antibodies are produced in the laboratory, and it's a protein that functions like an antibody made from the immune system in response to an infection. This information I got off of Health Online. And it basically brings a specific, it's a binding, it binds to a specific molecule on the virus or bacteria. And that gives it a chance for your body to deal with it, which of course, all good things have a criteria by which you have to meet a checklist, if you will. And you have to be at least age 65 or older, which I didn't check that box. Obese, and thankfully I didn't check that box. I don't have diabetes. And cardiovascular disease, I don't have any issues there, nor do I have chronic lung disease. So this was eliminated as an option for me. Even though some of the people that were at the conference, I heard of at least 2 that did have this treatment and really felt like it helped them. They also say it needs to be done within the first 10 days of your first symptoms. So another treatment, and this is where my family and friends were, oh, you've got to get ivermectin, right? That's the big thing that was going around. So I did a little research on that, and the FDA has this, when you search, it comes up, it says why you should not use ivermectin to treat COVID-19. And their arguments maybe are a little light. It says because we haven't approved it yet for preventing COVID, and currently available data do not show ivermectin effective against COVID-19. Clinical trials are ongoing, is what it said. And again, as I continue to do my research on ivermectin, if you search ivermectin, you find out where you can buy it at Tractor Supply Company, at Marty's Farm Services. So really, ivermectin is used typically in animals to help them with a parasitic worm or something like that. So I do have a friend who's a doctor, and I just kind of threw that out there, and I said, what do you think of this? And her response was, I wouldn't take it. And so I didn't really pursue ivermectin anymore, but it does kind of speak to the misinformation, I don't know if misinformation, but contradictory information that's out there. Because again, as I did research, I came across this conclusion from the American Journal of Therapeutics. And they say moderate certainty evidence finds that large reduction in COVID-19 deaths are possible using ivermectin. Using ivermectin early in the clinical course may reduce numbers progressing into severe disease. And then they say the apparent safety and low cost suggests that ivermectin is likely to have a significant impact on the SARS-CoV-2 pandemic globally. So it's really interesting, again, how the experts, right? These are certainly doctors, and this is reviewed information, seem to contradict themselves. And I think that's been some of the issues that we've had as a society with people either getting vaccinated, not vaccinated, take this, take that, all these different things. The information just wasn't out there. And so if I go back to that photo of my kitchen counter where all these different types of medications were out there, that's what people are throwing at you when you end up with an illness that, hey, take this, take that, take this. And some of it maybe is good information and some of it not so. And like ivermectin is maybe a good example, is there's still information out there to be had about that. Well, by Friday, I was feeling much better. One of the things that I feel that second week really hurt me was not getting enough liquids, not drinking enough fluids. And what I say is, it just tasted so bad. I just couldn't drink enough. But by Friday morning, coffee, I could drink coffee again. And I know they kind of say, well, that doesn't really hydrate you, but if you drink enough coffee, I think it does. And what I say is coffee, it didn't taste like the coffee I'm used to, but it didn't taste bad. So I did my best to drink as much coffee, and tea was working too, so coffee and tea. And so that was Friday, and then certainly Saturday, Sunday, continue to lay low and drink as much coffee and tea as I could. So feeling much better today. Would certainly love to be there in person, but at the same time, I don't know at what point I'm not contagious anymore, so I'm going to give it some more time. Outside of that, I would definitely take any questions you might have. There, now you can see this smiley face instead of the other one right there.
We do have a couple of questions here, so I'm gonna start, pass it around the mic.
And could you share with us the status of your vaccination or not vaccination prior to getting COVID?
Well, are you asking, Galen, if I was vaccinated before getting it?
Yeah, did you get the vaccination prior to getting COVID or not?
I had not been vaccinated, no. And that's not to say I'm an anti-vaxxer. I guess it just wasn't a priority for me.
Hi, this is Jim. I'm just curious about the ivermectin in terms of the amount of vetting that they did on the vaccines was hundreds of thousands or tens of thousands of people. And ivermectin has never gone through any of that kind of thing. And how can people not want to get vaccinated with those kind of study results, and then in ivermectin not having that kind of volume of study to validate that?
Yeah, I think what's really interesting is they see people in other countries using this ivermectin and even some of the other drugs that they're using. And I talked to the doctor a little bit about that, and presumably it's a safe drug, right? I think that's part of their argument, is that people use it all the time and have used it for years. But what the one doctor told me is she believes that, I don't know how they correlate, but a lot of the third world countries where they're having positive results with this ivermectin is they tend to have a lot more parasites and parasitic issues than we do here. And she just thought that that was easier for them to go ahead and use. And people have some level of confidence that it's a safe drug. So.
All right, I think we'll take some questions online. Let's go with Mary Jo and then Lynn.
Yeah. So the American Journal of Therapeutics, I've never heard of that. If it was the American Medical Association Journal, I'd take that seriously. I think the American Journal of Therapeutics is not highly rated. It is peer reviewed, but it's not one of the top journals. So, I mean, it matters where you're getting your information, right?
Yeah, I certainly I look at them as, I don't know where they rank in terms of if they're up there with the AMA or not, but I would assume that they are peer reviewed and that the information they're putting out is credible. But again, I would say that there's not much information on either side of that whole ivermectin argument, which is what the FDA said, right? We don't have enough clinical data to be able to give you an advice on it one way or another, other than we've never used it for COVID. And until we get more information back on some of the clinical tests for COVID, they're going to reserve judgment on that.
All right, let's go with Mary Jo.
Thanks. Thanks a lot. And thanks so much, Ed, for sharing your story. I really, really appreciate it. So we're all struggling with, this, whether to, to go to conferences or not. And, I'm curious, and I missed what, if you said, were there masks? Was anyone wearing masks at your conference? Because this is a big question that I'm having now. I'm going to a conference this week and they are requiring it, but I was at a 2-day one last week and they weren't. So, and I'm struggling with whether to go to any at all. So can you just share, were they wearing masks at all, or was that at all a consideration?
they were not wearing masks. And again, I think if you look at what the medical industry world uses for a mask versus what us general public uses for a mask, it's quite different. When I went to the doctor, she looked at the mask I had on and said, "Here, use this one." So I think in order for you to have a better protection in
Wear
that case, you find the right mask.
Wear a better mask. I agree. I'm getting some better masks myself because now that I'm getting out and about a little more. And just another question. So you've been in touch with the other people and you said some of them had been vaccinated and then they still got this. Do you know if their symptoms or with how they experienced it was different than yours? Was it they say that if you've been vaccinated, the results are a little bit easier, the outcomes are a little easier if you've been vaccinated. Just curious.
I haven't heard from everyone, but I know the one individual I heard from this morning said it went through her really quickly. So it sounded like it was a couple of days and maybe didn't even knock her down at all. And the other one, that I know of, other two, they certainly have, through the email, been planning to do other things. So it's not like they've been isolated or confined to a bed or anything like that. But at the same time, both those two have had that antibody infusion because they qualified for it. So.
And so this is my last question, and you probably have answered it for other people. So do you wish you had been vaccinated, or would you, we're now requiring vaccinations in Ramsey County of our employees because we just feel that it's so crucial. So do you wish you would have been vaccinated? Or are you encouraging people? You said you're not an anti-vaxxer, so you would encourage people to get vaccinated, or?
Yeah, for me, I'm not one who gets the flu vaccine either. I like to say I don't live in fear of getting that, but maybe that's not a fear issue. But what I would say certainly is, do your research and do what's right for you. Do what's right for you. I'll leave it there.
Okay, thanks.
Lynn, ask your question.
Were you able to keep your wife away from you? And did she or did she not get COVID?
My wife was a trooper, let me tell you. She brought me down food, whatever, not that I ate much, but ice packs and things like that all the time. At this point, she has no signs of COVID. So I don't know how she avoided it, but we're very fortunate that way.
And has she been vaccinated?
She has not, no.
All right, Lynn Scott.
Thank you, Ed, for sharing your story as well. And first of all, I just want to say I'm glad that you're here and feeling well, and thank you for that. I wondered, what was the protocol at the airport when you were returning home for a person who has COVID, active COVID at the time? And I don't know if you flew or whether you drove, but if you flew, what was the protocol when you arrived at the airport as far as you getting on a plane and coming back here?
That was interesting because when I returned home, I maybe didn't feel, I certainly didn't feel like I had COVID. I don't know what that even means, I guess, but I still had my taste and some of those other things. So it wasn't an assumption that I had COVID. But what's interesting is when you go to get on the plane, they ask you 3 questions, and the questions they're asking you are, have you had a positive COVID test in the last 10 days? And it's like, okay, no, right? And so they really didn't, it's a check the box when you're getting your electronic ticket kind of thing. But again, if you look at the data that's out there, you're asymptomatic, you're contagious like 2 to 3 days before you have symptoms. So, you know, people travel all the time with the symptoms and don't, or pre-symptoms and are contagious and don't know it. So it's a tough thing.
Were you required to wear a mask on the plane?
Yes, that we,
Okay.
yep, mask all the time at the airport and on the plane. Yep.
Thank you.
All right, well, Ed, absolutely, I echo Lynn. We're happy that you're feeling well now, and we look forward to your return and when you are able to, but we're just so happy that you feel well now. And appreciate you sharing with us your experience. And I'm actually going to turn it right back to you, Ed, though, to tell us a little bit about who's going to be our speaker next week.
Yes, next week. Sorry, that's not me. I have to. Now does it work?
It's Jackie Johnson.
Jackie, can you hear me now? Is it working? It's, yeah, Jackie Johnson from the Youth Exchange next week.
Okay. All right. Well, thank you all for being here today. And yes, we have Jackie Johnson next week from the North Star Youth Exchange.